Haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Carcinoma of the rectum. So first, what is the age of onset? It is usually in the 5th to 6th decade. Common site of metastasis will be the liver or the rectum. Clinical features, there is a bleeding per rectum, that is BPR. And this is the most common symptom. Then there is a early morning. Bloody diarrhea can be seen. So bloody diarrhea in the early morning. This passage of bloody slime is seen. This spurious diarrhea, that is tenesmus, as well as backache, sciatica, as well as a weight loss. So weight loss can be seen. Next is, what about the diagnostic procedures? So this includes a rigid sigmoidoscopy. There's a rigid sigmoidoscopy as well as a biopsy as the initial choice of diagnosis. So biopsy is also initial choice of the diagnosing, and that the colonoscopy is mandatory for the adequate evaluation. So it is mandatory for the adequate evaluation of the whole colon and to rule out the synchronous lesions. So what is the IOCs? Investigation of choice for the staging of the most of the head and the neck region is going to be the MRI. And for the T staging, investigation of choice, it includes a rectum, TUS, TRUS, ultrasound. Then comes for the lymph node staging. So what happens to the lymph node staging? So lymph node staging is where there is an investigation of choice, is the endorectal MRI. So endorectal MRI is seen. Now let's look at the TNM staging. TNM staging, it's TX, means the primary tumor cannot be assessed. So primary tumor can't be assessed. Then comes T0. The T0 is where there is no evidence of the primary tumor. So no evidence is seen. Then comes TIS, which stands for the carcinoma in situ. For the carcinoma in situ, there is an intraepithelial, and also as invasion of the lamina propria. Next is T1. T1 is a tumor invading the submucosa. So tumor invading submucosa. T2 is a tumor invading the muscularis propria. So T1, a tumor invading submucosa. T2 is the muscularis propria. T3 is penetrating to the muscularis propria into the perirectal. So 3 is where it is going into the perirectal region. Perirectal fat, that is a mesorectum. Now T4A. So what is T4A? It is a tumor penetrating the visceral peritoneum. So visceral peritoneum. Next, after T4A, there is T4B. The T4B stands for the tumor direct invading. So the tumor, it directly invades the or adhering to the other organs or structures. Now NX. What is NX? NX stands for the regional lymph node. It cannot be assessed. So regional lymph nodes can't be assessed. So regional lymph node can't be assessed. What is N0? N0 means the lymph node metastasis and no tumor metastasis. There is no tumor metastasis. And looking at N1, N1 is 1 to 3 lymph node metastasis. So 1, 2, 3. Metastasis is N1, N1A. So what is 1A? It stands for the 1 lymph node metastasis. Then comes 1B. 1B stands for 2 to 3. 2 to 3 lymph node metastasis. Then 1B, it stands for 2 to 3 metastasis. 1C stands for the submucosal mesangial, as well as a mesangial or peritoneum covered paracolorectal. Peritoneal covered with a paracolorectal. TDs in the absence of the regional lymph node metastasis. N2 stands for more or equal to 4 lymph node metastasis. N2A is 4 to 6. Then M1 is where there is a distant metastasis. And M1A, it stands for metastasis that are limited to one organ. So one organ or the site. That is the liver, lung, a kidney, ovary, as well as extra-regional lymph node metastasis. Then comes the 1B. 1B stands for the metastasis to more than one organ or site. Now looking at M1C. M1C is a peritoneal metastasis with or without the metastasis to the, so it's a peritoneal metastasis. So this can be with or without the metastasis to the other organs. So what is the main treatment process? The treatment principle is that in case of stage 1. So stage 1 is where you do a surgical resection, and then comes the stage 2 and 3. So 2 and 3 is where the neoadjuvant chemo reduction is done. Neoadjuvant chemo reduction. Neoadjuvant chemo reduction is followed by the surgical resection, and then comes the stage 4 is where the neoadjuvant. So there's a neoadjuvant chemo radiation, and it is followed by the palliation plus the surgical incision. Palliation and the surgical incision. Next is the chemotherapy. The chemotherapy regimen, it includes the FOLFOX. So FOLFOX, it stands for IV. That is, it includes the folinic acid, the leucovorin. Then comes the fluorouracil (FU), as well as the oxaliplatin. To learn and grow daily like this, please do subscribe.